Accusations of institutional racism in Kansas foster care system hurting our kids. Plus, the latest push from the state touting masks as a way to keep kids in school. And a promise to leave no stone unturned in the investigation into the death of a Wichita teen at a juvenile facility. That's what we're talking about right now on Kansas Week. This is Kansas Week, and I'm your host, Dion Leffler, in for Pilar Pedraza. Sedgwick County authorities this week are saying it may take some time to figure out exactly how a Wichita teen died while in state custody. Cake's Hannah King gives us a closer look at what happened leading up to the death of 17-year-old Cedric C.J. Lofton.
All aspects of child death investigations are thoroughly investigated.
A tragic case. Sheriff Easter ensures a thorough investigation will take place in the death of Wichita teen C.J. Lofton.
We're 4 days into the investigation, being led by the KBI and us assisting, so we're gathering all the facts related to this incident and anything else that we uncover.
Sheriff Easter reveals a timeline that started on September 24th, where Lofton's foster father called 911.
Due to Mr. Lofton having a mental breakdown and being paranoid. He also wanted Mr. Lofton to be evaluated for his mental health issues.
Just after 1 a.m., Wichita police was dispatched to Lofton's home. Nearly an hour later, an officer in trouble call was dispatched. Officers took Lofton to the juvenile intake center. Hours later, police were called to take Lofton from the center to a hospital.
Due to the fact that he was having more mental issues and was having issues with JIAC staff, and when it comes to trying to fight them.
CPR was performed before Lofton was taken to the hospital. He would die 2 days later.
When there's a gunshot wound, when there's a stab wound, things like that, these are fairly quick turnarounds. But when there's no obvious signs of trauma, it means that more investigation needs to take place.
Investigators say a final report will not be ready until after toxicology is complete. Sheriff Easter says this is an ongoing investigation to determine what happened here at the Juvenile Intake and Assessment Center, and they will leave no rock unturned in their investigation. In Wichita, Hannah King, Cake News on your side.
And the Wichita branch of the NAACP responding with this statement saying it is, quote, waiting to learn more about the situation, understanding that a full investigation is currently underway by the Kansas Bureau of Investigation into the details of what occurred that led to Mr. Lofton's death. We request the quick release of any body cam and/or facility footage, end quote. Here to discuss this and other topics with us today, we're joined by State Representative Timothy Johnson, a Bonner Springs Republican, and State Representative Chuck Schmidt, a Wichita Democrat. Welcome, gentlemen.
Thank you so much.
Good to be here.
I'd like to talk a little bit about transparency. There has been a lot of concern among underserved communities about body cam footage, dash cam footage, those kinds of things. And a lot of places, a lot of other states release such materials routinely, and Kansas doesn't. Do we need to see some push to get a little more transparency in these kinds of cases?
Well, you know, in my background, and I did 31 years in the criminal justice field. Actually, my master's degree in forensic pathology was here at Wichita State. If you release it too soon, you jeopardize cases at points because other people then begin to examine. The protocols that are in place around this state, I believe, are excellent now. We've had to make modifications, but the fact that the KBI is leading this, it's going to take a little bit of time. I don't think there are extraneous circumstances in this, so I am not in a push to release information that could jeopardize a case either way.
Okay, Chuck?
Well, yeah, I would agree with that. I don't want to jeopardize a case, and I don't know what their guidelines are. I think eventually we need to see what happened. And first of all, it's a tragedy, and my heart goes out to that family. But I think what this points out more than anything is the necessity of mental health services in our state. Apparently this kid was getting some mental health assistance, but it's just something that is a real problem in our state, and that's one of the issues I'd like to address when I get in.
Well, we'll be addressing that actually a little bit later in this program at some length. Let me just ask, is there any other way to, increase the transparency, or to, just to figure out a way to reassure the public that steps that need to be taken are being taken? Tim, I'll ask you.
Well, clearly, when it's done, it has to be laid out, because everybody wants to examine it. Families want to see reasonable autopsy information. I'm sure the toxicology in this case, from what I understand, is going to be critical. You got to put it all out there. Your county attorney is going to have to be the lead, and if necessary, your state can step in and get involved.
Okay.
Well, and I would just add to that, eventually we need to see what happened. But I think Tim is right. We need to go through the process first, and then but in order for people to trust both law enforcement and for the people who are the victims of what's happened in this, they need to see the full facts, and it's got to come out eventually.
Well, that's good. I think we can move on to the next topic here. New data from the CDC shows mask requirements are keeping students safer in schools. Rebecca Chung with the KSN Capitol Bureau takes a look at how.
There's been many debates here at the Capitol over what's working in schools. Some schools are enforcing masks, others are not. Now health leaders say that's showing. Federal health leaders say schools without masks are 3.5 times more likely to have an outbreak. Some schools in Kansas are seeing spikes in positive cases, and a large number of clusters are popping up across the state. But for some school districts like Topeka Public Schools, this isn't the case.
We are not experiencing outbreaks. We're not identified as a cluster or a hotspot in any way.
This is helping keep kids and teachers in the classroom this school year, according to Lori Vaughter, who leads the district's nursing program. But she says it's not just wearing masks. The district takes an extensive number of steps to keep classrooms clean and ready for learning.
District-wide, there are UV lights that are in place after school hours. There's disinfectants that are used.
And it seems to be working, with less than 1.3% of staff or students testing positive. That's unlike some school districts in the state reporting large outbreaks. Right now in Kansas, there are more than 640 active cases in the state and 79 clusters. Now the state is getting more information on what's working on the ground in Kansas schools.
Wearing masks, hand washing, and staying home when you're sick, and all of those things. That really makes a difference. It's doing all of those things together.
The state is expected to release new numbers later this week showing case rates and vaccination rates in school districts, and that's so people can keep track of the latest information as well. At the Capitol, I'm Rebecca Chung.
Well, gentlemen, masks. It's a very controversial topic, but as we've seen, it does seem to have some effectiveness. I've talked to several of the leading infectious disease specialists in the state, and they pretty unanimously say that it's a good idea. Has the time come for a statewide order in schools?
Well, I don't like mandates, but I also don't like people dying and getting sick of something that's preventable. What we do know is masks work. They're not a foolproof, but they do work. What I can say is this. I spent 14 years as a superintendent of schools, and I'm just glad I'm not in the business right now because it's a tough thing to do. But what's important is we have got to keep kids in school. We learned last year how important it is for those kids to be in school. Online learning is fine when you have no other alternative, but it's best for them to be in school. And if it takes masks to do it, then that's what we've got to do.
Okay. What do you think?
Yeah, well, I'm going to take the devil's advocate on the standpoint I believe in personal choice. And I am concerned that masks, when placed on all children unilaterally, is not necessarily helpful. I have been substitute teaching in parochial schools this fall because I'll be in the legislature, and they're having lower rates by being unmasked and fewer cases, and those statistics aren't being noted. So, but I want Chuck's right, got to have them in school. You have to be in school to learn.
Well, how do we keep them in school? We've had multiple outbreaks, multiple clusters. We've had thousands of kids quarantined, how do we keep those schools open without, you know, what's the alternative?
Yeah, the answer, if we don't mask everybody, how do we do that? Again, I'm personal choice. That there are those that would argue and have some statistics that show that the masking, and I'm particularly in the elementary school grades, that certain issues are also coming up, and there are other health-related issues. And I see that in the two grandchildren that live with me going to school in terms of breathing and those types of things. The private schools that I've been in can simply quarantine a room, and they've had no more problems, and they still have the kids in the room rather than sending them home.
Okay.
Well, let me add to that. The kids don't have as much a problem with masking as the adults do. In most cases, kids are pretty compliant and will do it. And I just think we have to enforce that because we don't know who's a carrier and who isn't. And I think even though it may be unpopular with some people, if it saves lives, then it's worth it.
Okay. Well, on a related topic, we'll talk about vaccines next. In Topeka, top Kansas legislators are forming a committee to examine the impact of federal COVID-19 mandates and what they call government overreach. Members of the Legislative Coordinating Council this week announced a special committee on government overreach and the impact of COVID-19 mandates in response to President Biden's plan for vaccine and testing requirements impacting federal employees, healthcare facilities, and large businesses. The group says this is the best way to determine what steps are available for the legislature, Congress, or the Attorney General to take.
A lot of Kansans are upset with the speech that our president gave talking about some of these mandates are coming down. And so we really want to make sure Kansas is in the best position to combat if his actions do match his speech. And so we want to know what we can do to stop the federal mandates.
There are some concerns about creating the committee, though. Democratic Senator Dinah Sykes telling the KSN Capitol Bureau, quote, "We've had 6,000 deaths in Kansas because of COVID. I just don't want this committee to politicize this anymore, and we need to have solutions. How do we get out of this?" End quote. Supporters said this is a way to save tax dollars by preventing a special legislative session to address the matter. They also said it allows lawmakers to present a clearer picture of what the options are. Well, Chuck, I'd like to start off with you on this. And the question would be, how is this different from, how is the federal government telling the state legislature what to do different from the state legislature telling the school districts what to do, or others, other local units of government? It just kind of seems like it's part of the hierarchy.
Well, yeah, nobody wants somebody to tell them what to do unless they're the ones that get to tell someone else what to do. But the bottom line is this. We have a pandemic in this country. We have almost 700,000 people have died, and we need to do something. Now, normally, I'm a history major. Normally, in our history, when our country is attacked by something or someone, we pull together. I remember, I don't remember, but from history, World War II, we had rationing coupons. Women couldn't wear pantyhose. My dad tells a story about having to fix 6 flats on the way to pick up my mom for a date because they didn't have tires. You couldn't get tires. I don't know how that's any different than saying we have a vaccine that will stop this and will protect us, and we need to have it. Now, if I understand correctly, what the mandate says is if you work for a company, you have to either take the vaccine or you have to submit to frequent testing. So you still have a choice. Or the other choice you have is you don't work for that company. But, we have to think about the people in that company too and protect them as well.
Tim, I suspect your perspective is somewhat different.
It is. This committee issue, it's going to come up. I have signed the petition for a special legislative session because people feel like we are not dealing with it locally. I strongly believe that the school boards, which at the local level should decide for their school, because each district around this state, the state shouldn't set a mandate for the school boards. This issue deals with a vaccine that I disagree with its reliability and effectiveness, and have seen a lot of statistical data not necessarily supporting that it is healthy for everyone. So what I say is personal choice. I'm not saying it's not necessary or good. I'm saying we have to have personal choice. But in fact, the president is forcing everyone to take it. And I have a relative, a son that lives with me. He'll be kicked out of the Army if he doesn't take this shot. That's wrong. That he should not be forced. He should have an option.
Where are you getting this data?
I have listened and worked with several scientists in the Kansans for Health Choice, and we talk about that, and there are some real problems with the various vaccines. I've had a grandson that had a very serious reaction to the shot. So I think that a parent has to make a choice for their child, and to make it a mandate is inappropriate, and that's just my personal opinion.
What are really the chances of a special session on this? I mean, and what would the special session accomplish, or is this just grandstanding for the people who oppose masks and vaccines and those kinds of things?
Well, first, it takes a governor to call one. If not, there has to be a 2/3 majority, which probably would not be something that's going to happen. I mean, realistically, that's not going to happen. But the committee that was set up is a committee with bipartisan, and I think that it can get started and at least deal with it publicly and let those people challenge it. And whatever they come up with, then I'm fine with that.
And Chuck, I think you wanted to say something.
Well, talking about mandates, last year the legislature did pass a mandate. They mandated that if schools close, they can't do online learning beyond a certain amount. And that's hurt us, because we've got some schools that have had to shut down for a period of time. I've had calls from parents and grandparents who said, my kid's getting no education because they can't do the virtual learning because the state has mandated that you can't do that. So mandates are bad if you don't like them, and they're good if you like them. And the bottom line is we're talking about people's lives. And again, you have a choice. You don't have to get the mandate. You can get tested frequently, or you can choose to work at another job. That's your choice. Now, talking about mandates, I don't know, it's 8 or 10 things that every kid has to be vaccinated by when they go to school. That's a mandate. When you join the military, you have to be vaccinated, I don't know how many different types of vaccines. There's all kinds of those. We're trying to protect the public and people's lives. That's what this is about.
Okay, well, we could probably talk about this for much longer, but we do need to move along. Black children in Kansas are more likely to be investigated and removed from their homes, while white children see more rapid reunifications with their families. That's just part of what statistics and reports show. The Kansas Reflector reports about 800 people participated in a Kansas Racial Equity Collaboration online program this last week. Its goal to start shifting from a state foster care system designed to control rather than support minority families. DCF Secretary Laura Howard said, quote, "We have not focused enough on the harm black and brown families experience in the foster care system. This must change." Nationally, 53% of black families were investigated for abuse or neglect, while in Kansas, black children are placed in foster care twice as frequently. Samantha Mellerson of the Hayward Burns Institute says the conversation about institutional racism in Kansas would be more productive if the emphasis could be moved from rehashing responsibility to building understanding. She says, quote, "We're all swimming in this regardless of where we're from, regardless of race and ethnicity. It will take all of us to understand it, recognize it, and begin to unpack and dismantle it." Chuck, I'd like to start with you on this one. What kind of changes do you think could affect this situation?
Well, I don't really know. I'm proud of the department that they've got somebody that is looking into this, and they've got somebody that's their main concern. I don't know enough about the facts to say whether there's institutional racism or not. What I can say is this, and I think Tim and I agree on this. I'm not very impressed with the foster care system in Kansas, and I think it's been in trouble for a long time, and I think there needs to be some real serious oversight and probably some drastic changes.
Tim?
Yes, we talked earlier, we kind of renewed some acquaintances from 50 years ago we didn't know. I'd love to see him on our Child and Seniors Committee because he has background there. I'm on the Oversight Committee that was just permitted, and I agree with some of those statements that she shared. One issue for us in Kansas is the critical need for foster care homes. And along with that, especially for the Hispanic community, we don't have the foster care homes with people speaking the language. We don't have the numbers of homes necessary for African American children. We need those homes for these kids. And I'm hopeful that maybe we can delve into that as part of the issue where the foster kid actually goes.
Okay. Well, moving on, the suicide rate in Kansas continues to climb, spurring new efforts to address mental health concerns across the state. Once again, here's Rebecca Chung from the KSN Capitol Bureau.
Here, lawmakers are holding hours of discussion on the issue. They're talking about suicide prevention efforts and breaking down the stigma around mental health. And in the pandemic, we're seeing an even greater need to open up talks about these struggles and how to deal with them.
So next to your head, as long as it's comfortable.
Practicing mindfulness, meditation, just some of the ways people are learning to unwind. Now more than ever, people are finding ways to make mental health a priority.
We used to get about 8 to 12 referrals a month for outpatient therapy, and now on average in a month, I get 30 to 40 referrals.
And it's something mental health advocates like Jolie Eckert are seeing. Eckert runs a program offering stress relief classes in Topeka, and it's something she says is becoming even more important during the pandemic.
The isolation alone leads to greater levels of anxiety, of depression, of suicidal thoughts.
According to Kansas Health Institute, the suicide rate in Kansas is nearly 1.5 times higher in recent years than about a decade ago. Now people are finding time to connect with others and themselves. The classes are open to everyone and teach people how to relax through tough times.
We've had people go through a lot of stressors like losing a family member, and just coming here and forgetting about that during their workout has helped them tremendously.
Now, these are just some of the things people are doing to relieve stress during the pandemic. Another thing lawmakers are talking about here is making these resources more available to vulnerable communities. At the Capitol, I'm Rebecca Chung.
Well, Chuck, you've talked, you mentioned earlier that you think that there needs to be something done about mental health in this state. Here's your chance.
Well, I think, we need better mental health services, and I think the pandemic has brought that to the forefront too, because it's created more issues for people. Now, I understand that last year the legislature did make some pretty good moves that is going to take time to show the effect, but there's some federal money coming that will allow counseling and therapy for people for mental health issues. I think what this also shows is the necessity of Medicaid expansion. Most people think of Medicaid expansion as something for physical health, but it's just as important for mental health. And many of the people that can't get that help fall in that gap where they don't qualify for Medicaid, but they don't have enough money to have insurance. And I think if we can cover those people, I think that will make a big difference. So that's one way we get to that.
Okay. Tim, if I may,
yes.
I came here 24 years ago. And some of the first stories that I ever did here were about problems with the mental health system. Mm-hmm. There have been plans, there have been proposals, there have been organizations, reorganizations, reorganizations, privatization, and not only has it not gotten better in that period of time, it's gotten worse. How do we get out of this?
Well, one that I saw is in our schools. We need to have it there. And Chuck, did you have the increase in social workers that you were able to work into your staff?
We did some of that, yes.
Yeah.
Yes.
The funding has to be there for that.
Yes.
So that and I think that's the COVID money we were talking about.
Right.
I think it's got to start at that level. We're talking elementary on up through 12. because they're in the building with these kids. And I know in our school district, Baser Linwood, we're making great strides to bring in social workers, which is a form of the counseling. It just terrorizes me when I have to look at a kid that's committed suicide or deal with those issues. One issue that goes with that, and the law enforcement case you had here, that sounds like a mental health issue for that young man. I mean, very clearly. And law enforcement is struggling as much as schools are because they're not trained the same, and we don't have the facilities. Osawatomie State Hospital has literally been closed to us.
Yeah, exactly, Tim. And Diane, you know, I appreciate what you said. You've been here, you said 24 years, but I can remember back 30, 40 years ago, Kansas was a model for mental health. We actually had great programs. Parsons Hospital, Osawatomie hospitals were doing great work. And we had, of course, we had managers going in Topeka at the time too. We've lost that. And it's, you know, and then back to the schools issue that Tim mentioned, I would agree 100%. One of the first things I did after we got some extra money in our school is I asked my administrators, what's the most meaningful thing we can do? And they said, hire a social worker. And so we did. We hired a social worker. Now, the other thing is counselors. And we need more counselors in our schools. There's a shortage of counselors. But the other part of that is people say they want more money into instruction. The salary of counselors don't count towards instruction. But that's just as important as that teacher when you're dealing with mental health issues.
That's ditto. He's so correct. The full scope of counseling, whether it's the social worker, whether it's an actual health worker, are just our counseling for regular academics. But they're the ones, our teachers are the people that find these issues before anyone else.
Can I add something quickly? Because of your law enforcement background, you know this, and I've talked to a lot of law enforcement people. Somebody has an episode, the police get called, they get locked up, and the first thing they do is call mental health, and mental health comes and takes care of them, and they get no compensation most of the time. That's got to change.
Okay, well, on that note, we have to finish our show this evening. Thank you again, Chuck, Tim, for joining us, and we'd also like to thank our news partners at Cake News, the Wichita Eagle, and KSN News for sharing their materials with us. I hope you've enjoyed our discussion as well, and we'd love to hear your thoughts or ideas for future shows. Just email us at kansasweek@kpts.com. For now, stay safe and have a great week.